We are starting a new series where we will cover the subject of pharmacology. Today we are going to look at Introduction to Pharmacology. This is the first topic in our Pharmacology series. So as a way of introduction, I want to ask you, have you ever wondered how the medicines we take actually work, or why the same drug might affect different people in vastly different ways? Understanding these questions is the essence of pharmacology, the science behind every pill, injection, and medical treatment we rely on. In this video, we'll dive into the foundations of pharmacology, an essential field of medicine that connects the intricate workings of the human body to the powerful effects of drugs. Pharmacology isn't just about learning drug names, it's about understanding their mechanisms, how they interact with our biology, and the critical role they play in healthcare. Whether you're a medical student, pharmacy student, or a curious learner, this introduction will give you a strong foundation in pharmacology and spark an appreciation for its real-world applications. By the end of this video, you'll understand what pharmacology is and its importance in clinical practice, how drugs are classified and why this matters for safe and effective treatment, the essentials of pharmacokinetics and pharmacodynamics and how these principles shape drug action. Key concepts like therapeutic drug monitoring and drug interactions, crucial for safe drug administration and avoiding adverse effects. Background. Pharmacology sits at the heart of modern medicine. It provides a framework for understanding how drugs can treat diseases, alleviate symptoms, and save lives. On a global scale, medications help millions daily, whether it's treating chronic diseases like hypertension or managing acute conditions like infections. According to the World Health Organization, medications play a role in addressing leading causes of death worldwide, including heart disease, cancer, and infectious diseases. Pharmacology's relevance extends to all healthcare fields, guiding how drugs are developed, tested, prescribed, and monitored. Now, let's dive deeper into this critical field. Definition of the word pharmacology. The word pharmacology derives from the Greek pharmakon, meaning drug or medicine, and logia, meaning study of. Together, it signifies the study of drugs, including their effects, sources, and uses in medicine. A more comprehensive definition of pharmacology would be, pharmacology examines the complex interactions between chemical agents and living organisms to determine how drugs influence physiological and biochemical processes. In this field, drugs are commonly classified by their therapeutic use, mechanism of action, or chemical structure. For example, therapeutic classification groups drugs based on their clinical application, antibiotics for infections, analgesics for pain relief, or antihypertensives for managing blood pressure. In contrast, mechanistic classification organizes drugs based on their specific action. Beta blockers like propranolol, for instance, are classified as adrenergic receptor antagonists because they work by blocking beta-adrenergic receptors to reduce heart rate and blood pressure. Understanding drug classification allows healthcare providers to choose the most appropriate treatment, predict potential interactions, and minimize adverse effects. Let's briefly look at pharmacodynamics. Pharmacodynamics explores how drugs exert their effects on the body, primarily through interactions with cellular receptors, enzymes, or ion channels. This is fundamental to understanding the dose-response relationship and therapeutic efficacy of each drug. A key concept in pharmacodynamics is drug-receptor interaction. Drugs bind to specific receptor sites, leading to a cascade of cellular changes. Two important factors, affinity and intrinsic activity, determine a drug's potency and efficacy. For instance, morphine binds to mu-opioid receptors with high affinity, which is why it's highly effective in managing pain. The dose-response relationship is another fundamental principle. It describes how a drug's effect changes with varying doses. The EC50, or the effective concentration for 50% of the maximal effect, is used to assess potency, while the therapeutic window defines the safe and effective dose range. For example, morphine has a potent analgesic effect at moderate doses, but higher doses significantly increase the risk of respiratory depression. Understanding this relationship helps clinicians determine safe and effective dosing strategies. Dose-response relationship is what gives rise to dose-response curves. Dose-response curves illustrate the relationship between a drug dose and its effect, showing how responses change with increasing doses, helping to identify potency, efficacy, and therapeutic range of a drug. Another concept that is very important in pharmacology is pharmacokinetics. Pharmacokinetics involves drug absorption, distribution, metabolism, and excretion. Known as ADME in short. Pharmacokinetics focuses on how the body handles drugs, specifically how they're absorbed, distributed, metabolized, and excreted. This process is essential for determining dosing regimens and ensuring optimal therapeutic outcomes. Under this broad concept of pharmacokinetics, we want to briefly look at absorption. Absorption describes the movement of a drug from its administration site into systemic circulation. For example, oral drugs like acetaminophen typically have lower bioavailability due to first-pass metabolism in the liver. Once absorbed, drugs are distributed throughout the body. Distribution refers to the process by which a drug disperses from the bloodstream into various body tissues and fluids, influencing its therapeutic effect, duration, and potential side effects. Factors like lipid solubility and protein binding play a role here. Diazepam, a lipid-soluble benzodiazepine, easily crosses the blood-brain barrier, enhancing its sedative effect. The next process in pharmacokinetics is metabolism. Metabolism refers to the body's process of chemically altering drugs, primarily in the liver, to facilitate their elimination and reduce toxicity, affecting drug efficacy and duration. Metabolism mainly occurs in the liver, transforming drugs into more water-soluble compounds for excretion. The liver enzyme CYP450 is vital in this phase, as seen with drugs like warfarin, which is metabolized by the CYP2C9 enzyme. Variations in CYP450 enzymes due to genetic factors can impact how quickly or slowly a drug is metabolized. So basically, metabolism in pharmacokinetics occurs in two phases. Phase 1 involves modification reactions, for example oxidation, reduction, or hydrolysis. These reactions increase drug polarity, preparing it for Phase 2. In Phase 2, conjugation reactions such as glucuronidation further enhance drug solubility, facilitating excretion. That takes us to the last stage in pharmacokinetics, which is excretion. Strictly speaking, both metabolism and excretion are part of the elimination process for a drug. Excretion specifically refers to the process of expelling the unchanged drug or its metabolites, mainly through urine or feces, but also via sweat, breath, or saliva. Renal function is crucial in drug excretion as the kidneys filter and eliminate waste, including drugs and their metabolites, influencing drug dosing, efficacy, and toxicity, especially for renally cleared medications. Approximately 30 to 40% of drugs are excreted by the kidneys, while the liver and other pathways handle the remaining excretion. A good example of a drug which is renally excreted is amoxicillin. This means in cases of renal impairment, dose adjustments are necessary to avoid drug accumulation and toxicity. Therapeutic drug monitoring and toxicity. Therapeutic drug monitoring is a very important concept in pharmacology. To ensure safe and effective dosing, therapeutic drug monitoring, TDM, is used to maintain drug levels within a therapeutic range, especially for drugs with a narrow therapeutic index, TI. The therapeutic index is the ratio of a drug's toxic dose to its therapeutic dose. Drugs like digoxin, which have a narrow TI, require close monitoring, as small variations in dose can lead to toxicity. Examples of toxicity range from mild side effects to severe conditions like hepatotoxicity or nephrotoxicity. A notable example is paracetamol overdose, which can lead to acute liver failure due to toxic metabolite buildup. Drug interactions. Drug interactions occur when one drug affects the pharmacokinetics or pharmacodynamics of another. Pharmacokinetic interactions can alter absorption, distribution, metabolism, or excretion, while pharmacodynamic interactions can enhance or inhibit the effect of a drug at its target site. For example, combining warfarin with ciprofloxacin can increase bleeding risk, as ciprofloxacin inhibits warfarin's metabolism. Additionally, taking ACE inhibitors like enalapril with potassium-sparing diuretics such as spironolactone may lead to hyperkalemia, a serious condition if untreated. We want to look at the concept of adverse drug reactions. Adverse drug reactions or ADRs are unintended, harmful effects that occur at normal drug doses used for prevention, diagnosis, or treatment, potentially leading to patient discomfort, dysfunction, or more serious health complications. Adverse drug reactions are classified as type A meaning predictable or type B meaning idiosyncratic or unpredictable. Type A reactions, such as gastrointestinal bleeding from NSAIDs, are dose-dependent and more predictable. Type B reactions, like penicillin-induced anaphylaxis, are rare but potentially life-threatening, requiring immediate medical attention. Pharmacodynamics. What is pharmacodynamics? Pharmacodynamics is the study of how an individual's genetic makeup influences their response to medications, aiming to optimize drug efficacy and safety by personalizing treatments based on genetic variations. For example, genetic differences in enzymes like CYP2C19 can significantly impact a drug's efficacy and safety. For instance, the antiplatelet agent clopidogrel is metabolized by CYP2C19, and individuals with certain genetic variants may have a reduced response to the drug. As a result, genetic testing may be recommended to ensure optimal therapeutic outcomes. The last concept we will look at are the principles of rational drug prescribing. Rational prescribing involves choosing treatments based on evidence, patient-specific factors, and cost-effectiveness. For hypertension, for example, guidelines such as NICE guidelines from UK recommend starting with an ACE inhibitor or calcium channel blocker, such as ramipril or amlodipine. These decisions consider clinical evidence, the patient's medical history, and potential interactions, emphasizing the importance of a patient-centered approach in pharmacology. Recap. To recap, pharmacology studies drug interactions with biological systems. Drug classification helps organize drugs based on therapeutic use, mechanism, or structure. Pharmacodynamics and pharmacokinetics explain drug actions and how the body processes drugs. Therapeutic drug monitoring ensures safe dosing, especially for narrow therapeutic index drugs. Drug interactions and ADRs highlight the importance of understanding possible drug reactions. Pharmacodynamics and rational prescribing support personalized and effective treatment plans. Conclusion. Now that you understand the essentials of pharmacology, this foundation prepares you to delve into more advanced topics. Understanding these principles is vital for anyone in healthcare, as it forms the basis of safe and effective patient care. Be sure to join us in the next video where we'll explore the intricate world of pharmacodynamics, digging deeper into how drugs interact with our bodies at a molecular level. For further reading, consider resources like Basic and Clinical Pharmacology by Bertram G. Katzun, Anthony J. Trevor or Rang and Dale's Pharmacology or Goodman and Gilman's The Pharmacological Basis of Therapeutics. My sources and references are Basic and Clinical Pharmacology by Bertram G. Katzun, Anthony J. Trevor alongside other sources. Thanks for watching. Don't forget to like, subscribe, and leave a comment if you have questions. See you next time as we continue our journey through the world of pharmacology.